Hi, everybody. My name is Maiwa Oke. I'm a student here at Princeton University. I'm class of 22. I'm a neuroscience student pursuing a certificate in the global health program. And today I want to talk a little bit about my summer. I spent my summer at the CINJ, and it was a really great experience, and I just love to tell you all about it. The title of my presentation today is The Geography of Cancer and Analysis of Cancer Risk Factors in the State of New Jersey. So I worked with the CINJ, which is the Cancer Institute of New Jersey. And just to give you a little bit of a background as to what the group does, the CINJ is sort of this all-inclusive comprehensive center centered around cancer research in New Jersey. It's housed at Rutgers University and has multiple wings. There's a research wing, which does a lot of basic science lab work in regards to cancer. But what I spent most of my summer doing was working with the community outreach and engagement team, which in says does a lot of work in reducing the cancer burden in New Jersey. As some of you may or may not know, New Jersey actually has the second highest cancer incident rate in the United States, which is crazy. And the community outreach and engagement team really does try and put an effort to sort of help reduce that cancer burden. They do this by working with public health workers and public health organizations throughout the state. So this may include hospitals, free clinics, mobile clinics, etc. And through specifically the Screen NJ program, they basically provide funds to a lot of these institutions to help provide free screening for patients who can't otherwise afford to get screened for cancer otherwise. The organization also does a lot of work with education, so they often partner with community organizations, for example, churches, other sort of community organizations, and they essentially do a lot of work with them to help distribute information to citizens of New Jersey, especially citizens from underprivileged backgrounds, so that they can learn how to reduce their cancer risk by making more preventative choices in their healthcare choices. And so I want to talk a little bit about what I specifically did. So I spent a lot of time sort of in the first half of my summer working with the community outreach and engagement teams New Jersey catchment area survey. So this survey essentially was meant to be sent out to the entire state of New Jersey, just to basically get a good sense of how people, what people's attitudes were towards cancer, sort of how they were making steps to prevent cancer, whether or not they were engaging in any sort of behaviors that would increase their cancer risk, such as smoking, alcohol use, etc. The New Jersey the CINJ's Cancer Outreach and Engagement Team's catchment area is the entire state of New Jersey. And something that becomes very clear and apparent, especially for New Jersey residents, is that there's a lot of diversity in outcomes throughout the state. And so one of the things that the New Jersey Catchment Area Survey tried to do was to sort of help see like hotspots or areas in the state where there's high prevalences of people, for example, not getting screened for cancer or engaging in risky behavior in regards to cancer risk. And so I spent a lot of my first half of the summer sort of working on that, helping them out with drafting questions, et cetera, et cetera. The latter half of my summer was spent working on an independent project to sort of geographically identify cancer risk in the state of New Jersey. And so what I did here was that I took data sets, a lot of open data sets from the New Jersey GIN website, and I essentially mapped and plotted these maps sort of onto the state of New Jersey just to look for trends. And this was extremely meaningful work for me personally. I had spent the previous semester taking a course on R programming, and so it was really rewarding to be able to use the skills and the knowledge that I learned in the class towards a very practical application. On my poster, I've sort of put up two maps that I thought were really interesting. I ended up making like 20 plus 30 maps, a lot of maps. But these are two that I really, really think are quite interesting to take a look at. So let's zoom in into the first one on the upper right-hand corner. Okay. So this right here is a map of the ethylene oxide cancer risk. So the data for this was taken from the EPA. They have a list of a bunch of toxins, and they list the cancer risk associated with these toxin exposure in each census tract. And this cancer risk is measured in like risk per million. So the chance in a million that an individual resident will develop cancer. And so ethylene oxide is associated with colorectal cancer, which is one of the priorities of the community outreach and engagement team, because the colorectal cancer incident rate is quite high in New Jersey. And as you can see here, there's actually a really interesting hotspot right here in Washington Township in Warren County for ethylene oxide. Further investigation sort of revealed that this really high cancer risk is due to pollution that was in the water systems. And so a lot of these residents were drinking water very heavily polluted with ethylene oxide, hence the very high cancer risk. I do want to stress when we think about cancer risk and we see numbers like 100 per million, they can seem quite small. However, it's really important to recognize that a lot of these cancer risks are quite additive. And so for many people, there are other things that may increase their cancer risk aside from just this one factor. So for example, they could be old, they could have drunk a lot of alcohol in the past, they may have genetic factors which make it more likely that they will sort of develop cancer later in life. And so when we see things like 108 per million, that is actually quite alarming, despite it sort of sounding like it's not at first glance. So this was a really interesting finding. And I am very, curious to see what the cancer outreach and engagement team, sorry, the community outreach and engagement team will do with this data later on. The second map I do want to bring to light. So most of this project I spent sort of doing a specific focus in the Camden County region, largely because the cancer incident rate is quite high there. And as you can see here, you can see a pretty stark divide in low income percentages here. This data was taken from the US Census Community American Community Survey, and low income was defined as having an income level at 200% or lower of the poverty line. And so as you can see here, there's pretty stark differences between certain census tracts. And if you were able to take like a pencil and sort of draw the map of the municipality of Camden City, you actually would see that this line sort of tracks really well with the city limits. And so this is extremely concerning, sort of given a lot of the other additive factors. If I were to show some of the other environmental carcinogens in the Camden County, you would also see those sort of overlaid with this low income percentage. And as we all know, people who tend to come from poorer backgrounds are less likely to have access to healthcare, or are also more likely to, if they have access to healthcare, are more likely to have access to worse healthcare. And so this is a huge, huge, huge cancer risk. The censorship was extremely informative. I have always sort of been interested in public health, and it was really great to have a hands-on experience and to really experience what it's like to do public health research on a ground level. A question that I personally have is that given the remote nature of this internship, I was pretty removed from these communities that I was analyzing. And so for me personally, it would have been really interesting to sort of see how a lot of the factors that I identified in my data analysis sort of played out day to day in the lives of the citizens. This internship was extremely helpful and extremely informative, and I would just love to thank Dr. Rita Musanti and my coworkers, Danielle and Emily, for being just such great resources and mentors. I would not have been able to complete this internship without them, and I'm just so grateful for all their help. So that's my presentation. I hope you all enjoyed it, and I hope you all have a great day. Thank you for watching.